So what I'm going to do is I'm going to outline a framework, or really make a number of comments about this topic. Then I'm going to give you a little bit of information about the electromagnetic fields story, and then I'm going to draw a number of conclusions. Next. So the key scientific issues, I think, there are many, but the most important ones are surely that most environmental exposures in this country at this point in time are at very low levels when we're talking about the exposure of the general population. And for example, to DDT in food and in the environment, this is environmental tobacco smoke, that this is at a low level, and radon in homes. And let these stand for a long list of possible exposures. And of course, this is very different from the situation, particularly in the past in this country, but in developing countries still, where people can have very significant exposures. And here too, it should be said, there are occupations where people do have serious exposures. There are groups that have serious occupational exposures and serious risk of injury, and none of what I'm about to say is to minimize that fact. Secondly, when you're looking at when you want to study the epidemiology of chronic diseases, such as lung cancer, heart disease, Alzheimer's, colon cancer, whatever, you're looking at diseases of long latency that develop over decades. The initiating events probably occurred decades before the clinical manifestation of disease. You're dealing with, the task would be to assess what is an individual's exposure over a very long period of time. You know, heart disease, they discovered when they did autopsies of pilots in the Korean War, they discovered that atherosclerosis started in the late teens, and it probably starts even earlier. So if all you have is a snapshot of what someone's exposure is at one point in time, this is maybe not adequate to say that something is involved in causing a disease. And very important is the fact that because one can't conduct experiments on humans the way you can on mice and rats, that you have many potential factors that are in this gamish, in this mixture, and it's the task of teasing apart what is. You're not assigning people to an exposure group and to a control group, and so that you know that the only thing that differs between these two groups is the exposure that you're interested in. You can't do that. So the two main requirements of conducting this kind of study is that you need to have a substantial exposure. It can't be a whiff of something. And secondly, you need to be able to do a reasonable job of measuring that exposure. And next. So back up for 1 second for me. So just to make this a little bit more concrete, the effects of smoking cigarettes is one of the, if not the best documented causal factor for cancer and heart disease that we have. And if you think about it, in order to develop lung cancer, and I'm talking about averages, a person has to start smoking when he or she is 15. They have to continue to smoke day in, day out for 40 to 45 years, and then they will develop lung cancer. If they're unlucky, if they're to develop it, on average, I stress that, they'll develop lung cancer at age 62 or age 60 or something like that. If they stop in midlife at age 40 or age 45, the risk for lung cancer decreases over time substantially. The risk for heart disease decreases quite rapidly. I'm not saying that it goes down to that of someone who never smoked, but you get a substantial. So the point is, you have to smoke on average a pack or a pack and a half of cigarettes per day. Some people in our studies have smoked 5 packs of cigarettes a day, the maximum. And but on average, you have to smoke a pack or a bit more per day, and you have to inhale, and you have to, in a certain sense, you have to work at it. There are chemicals, if you're exposed to certain chemicals in shipyard work, or were 50 years ago, bischloromethyl ether, you could be exposed for a year, and it appears that you could develop bladder cancer due to that, 5 decades later. So this is one example of how it takes a certain amount of exposure to get have a real impact on disease that we can detect. Next. And I just want to make the point here that one has to make the distinction, which frequently, and it's sort of frustrating and amazing, very frequently is not made. People skip over it, probably for a number of very good reasons they skip over it. In order to put something like, I'm not saying that anyone should be around cigarette smoke, I hate it, and it exacerbates certain conditions, not good for infants, not good for people with existing respiratory conditions, and it's probably not good for anyone. But one should, based on the best studies carried out in the 90s in Europe and in the United States, where people wore monitors 24 hours a day, measuring 6 compounds in tobacco smoke that are distinctive of tobacco smoke. In other words, carbon monoxide doesn't enter into it because that comes from many other sources, and so on. Where people have done the best studies we have, it turns out that on average, again, exposure in the 90s was on the order of 1,000 the exposure of what the average active smoker takes into his or her lungs. So it's a ballpark estimate. And the same goes for certain other exposures. You have to sort of clue your readers, whether they're scientists or whether it's the public, into the fact that there are differences of order of magnitude here. Okay, next.